Hi, today I want to do a follow-up video. It's been almost 2 weeks since I had my breasts redone because I had a rupture. So my implants, if you saw my last video, my implants are like 23 years old. So I want to do this video because I have a lot of clients and a lot of friends that are older, 50 like me or older that have had their implants for a while and, just hoping to have them in forever. But, chances are that's not going to be the case. So I want to just give you an idea of one, how the healing is when you're older, maybe what to expect if you need to have yours done, or maybe if you suspect that you have a leak or a rupture or something. So I had silicone in, and when they did the surgery, it was leaking, but it stayed within the capsule, within the area. It didn't leak into my body, which is, kind of why I expedited the surgery, because I was nervous that it could leak into my body and I didn't want to have those problems or problems like that, because I have had clients where their silicone has leaked into their body. So my implants are like 23 years old, and I noticed something was off about in April, so a few months ago. So I went and had a mammogram and an ultrasound to figure out what was going on. So one, I could tell that one was slightly smaller than the other, but I just didn't know if this was like something that was going on with my body and my going through menopause, and that maybe my breasts were changing sizes. But I also noticed, aside from one being a little bit smaller, that when I worked out on certain days and certain exercises, I would feel like a burning sensation when I was working out and after. And at first I thought it was like just from the workout, but then I got suspicious that something was just off, like when something is like off with your body. So from the mammogram and from the ultrasound, they could tell that the implant looked like it was ruptured, but they couldn't definitively tell. But based on all the signs and talking to my doctor, my one implant was slightly higher. So he said that happens too, like it'll be slightly higher. Now I think it's higher because I'm still swollen. I'm less than 2 weeks out. So the goal was to swap out the implants for new implants and try and go a little bit smaller. So my previous implants were like, I thought 650 cc's. We were going to try and do a 20% reduction. So according to my doctor, you can go 20% smaller without having to do like a whole lift and more invasive surgery, which I really wanted to avoid that. So upon getting the surgery, he could only do a 100 cc implant small. I guess they had different sizes and they tried different options. And that was like the best that would look good without having to do like a massive amount of cutting, which I wanted to avoid as much downtime as possible. I did not want to have a lot of downtime. What to expect? So after the surgery, I was not like sore at all. So I want to let you know that it's completely different from when you originally get them done and when you're feeling like really tight, especially if you're going smaller or probably even staying the same size, because the capsule is already, created, where the place where they put the implant is there and your skin's already stretched out. So you're really not in a lot of pain at all. Which I was really surprised because I'm a lot older than I was. So I thought for sure there would be like some amount of pain, but there really wasn't a lot of pain. I did have a reaction to something that they used within the surgery, some tape or bandages or something on the side where my rupture was, like this entire side of my body. I got a rash like 3 days after, blistered, totally like really, really bad reaction, but that's not typical. But I guess I now have an adhesive allergy. So to limit your exercise and workouts for a couple weeks after, keep your blood pressure down, you can start walking. So I did start walking about a week after my surgery. I did like 5 miles a day and was fine. I did my first like lower leg workout yesterday. So I'm almost at 2 weeks tomorrow. But I'm still apprehensive to do a lot of like back or arms, because I just don't want to like displace anything. One really weird thing that did happen that I wanted to talk about and just let you be aware of is right after the surgery and a few days after, I noticed a weird noise and sensation, like a noise of like a swooshing around sensation. And I was like, and it was a loud noise, I could hear it. And it was almost like I thought the implant was too small for my body and it was like swishing around my body. But I was like, there's no way that could be the case because I have silicone. There's no way I could hear the silicone like moving around. So I went on Google and I checked it out. And apparently this is like something that can happen. So apparently when they take the implants out, they flush the area with water and then air can get in there. So the swishing that I heard and that you could hear if you happen to have the surgery and you hear it, don't freak out. So I have like a fuzz running on here. So apparently it's the water and the air mixed together. And when you move, it's like moving around. So it takes your body like up to a couple months to dissipate that. But really, I'm 2 weeks out and it's like, I think I've heard it like once, but it is like a really freaky sound and it really freaked me out. And I've read about other people online that have had it for longer, or sometimes, I don't know, when they fly, they get these weird noises because of the change in like altitude. I don't know. I've never had that problem, but it can take up to a couple months and it is a loud sound. So one of the girls online was like, my boyfriend can hear it and it's very embarrassing. So I just want to talk about it here and just let you know that this is something that I experienced and it's already gone almost 2 weeks out. So don't freak out if you have the surgery and you hear that noise. I feel like it's such an easy procedure. And I know a lot of women are older and they're going to have their implants changed out and worry about how they're going to heal. At least I did. And I'm in shape, so maybe that's why it was a lot easier, but completely different than the first time around. So don't freak out about that. The options are obviously you can have saline put in, silicone put in, or your own fat. And I feel like if I had enough fat on my body, I would have had fat put in. So if you have that as an option, I would consider it, because then you don't have to continually worry about your implants rupturing every time you get a mammogram or as you age, right? So now they're warranted 10 years. So when I'm 60, technically I could get them done again, but I don't want to keep having to get surgery done. So I know at some point I'm going to have them done again. You know, I don't know. I don't know how that works when you get to be like 70 and 80 years old and you have implants. Like, I don't know. Message me below if you're that old and you have these problems, but it's not a surgery I want to keep having. I don't want to keep going under anesthesia, but at this point in my life, I wasn't ready to like completely have nothing. I don't have enough fat to put in there. So these are just things to consider, as options. But I know a lot of my clients really don't want to have them done and they're hoping to just die with the ones that they have. But I'm just telling you, that's not going to be an option. They're not going to last forever. And you're going to have to do something. So just think about your options. Know that the second time, third time around, whatever it is for you, that it hasn't, for me at least, been a hard healing recovery process at all. That's it. It's pretty uneventful. It's been uneventful for me other than the rash. So message me any questions that you have. I guess if you don't mind having more downtime and you want to do a lot smaller of an implant and want to do a reduction and a lift at the same time, I just didn't have that much time to take off, and I really wasn't expecting to have a surgery at this point of time in my life. So it is what it is. But anyway, good luck on your journeys and message me below if you have any questions or my other social media. And I usually get back to everyone, but see you in the next one.